We are meeting here today at Itireleng Community Health Center here in Dobsonville, Soweto, to commemorate World AIDS Day under the theme, "We are in this together, Cheka Impilo." Also, we meet here today to celebrate the important work that nurses, midwives, and community health workers provide to our people and communities. The World Health Assembly designated 2020 as the International Year of the Nurse and Midwife, to highlight the indispensable work that is given by these people, these frontline workers. They give advice, they give treatment, life-saving care to our people. The agility of nurses has been very instrumental in our country in addressing public health epidemics, most notably the rapid rollout of antiretroviral treatment through nurse-initiated management of antiretroviral treatment, nurse-initiated management of drug-resistant TB, and of late, the management of COVID-19. Sadly, some of these dedicated cadres contracted these diseases in the line of duty, and some succumbed to these deadly diseases, most notably COVID-19. Their selfless diligence will always be appreciated by ourselves, by our people, and we bow our heads in their honor. May their soul rest in eternal peace. Our national theme for this commemoration is linked to the global theme, which is global solidarity, shared responsibility. This is a clarion call to every South African to make responsible health choices, since the social well-being of a community depends on the actions of every individual within that community. Each one of us needs to play their role in reducing new HIV and TB infections, in stopping gender-based violence and femicide, and in protecting the most vulnerable in our society, including adolescent girls and young women. Our Cheka Impilo National Wellness Campaign is integrated into the theme as a challenge to every South African to always Cheka Impilo and know your status. It is a campaign that aims to initiate people on HIV treatment, find the missing TB cases, and screen people for non-communicable diseases. Cheka impilo or testing. It's emphasized because if persons does not know their health status, it is difficult to treat them for a disease or a virus like HIV, TB, non-communicable diseases, as well as COVID-19. Since we launched this society-wide campaign in 2018, we have made some good progress as a country. Although much more work still needs to be done to ensure that indeed access to health care is a human right for all people and not only for a few. In the period from April 2019 to March 2020, we're able to test more than 18 million people for HIV, thus exceeding the annual target that we've set for ourselves of 14 million that we had set for this country. Our treatment program has also reduced the number of deaths due to AIDS by 60%. Fellow South Africans, we have chosen to commemorate this World AIDS Day here in Itireleng Clinic because of the sterling work that this clinic do to support adolescent girls, young women, and young men. This clinic offers youth-friendly services, and they also, in partnership with ward-based outreach teams in the community, as well as non-governmental organizations, work together on a day-to-day basis. We congratulate them for this. This relationship that this clinic has with the community, it's a practical reminder to all of us that we can only win the fight against HIV and TB if we work together in solidarity to save lives and livelihoods, protect the vulnerable and marginalized amongst ourselves. Earlier today, I had an opportunity to listen to these young people take part in that session. The young girls and the young men shared with us their experiences and insight as people, some of them living with HIV. This dialogue was more than just a talking session, as these young people also offered some light and some solutions to the challenges that they are confronted with on a daily basis. In the true spirit of being in this fight together, they are committed to work with us in dealing with all the issues that confront them. These issues include ensuring that they are treated with respect and dignity when they present themselves to our facilities, developing more strategies that will focus on targeted services that are meant for adolescent girls and adolescent boys living with HIV. Improving on social security, support for adolescents living with HIV, putting some strategies in place to address the stigma and discrimination which they suffer as adolescents living with HIV. We have listened to your input and are committed to supporting you going forward. As partners in the response to HIV and TB, we must respond to the health needs of our adolescent girls and young women. In the same vein, we must intensify the She Conquers campaign for adolescent girls and young women. With this campaign, we seek to decrease new infections in girls and young women. We seek to decrease teenage pregnancies. We want to keep our young girls at school. We want to decrease incidences of gender-based violence and increase economic opportunities for young people, especially adolescent girls and young women. We are, however, encouraged by the fact that HIV infections in adolescent girls and young women have declined in the last decade. Although there are signs in the recent times that are showing the negative, some signs of this infection wanting to increase once more. But we also know that much more work still needs to be done to protect and empower this vulnerable group in our society, the adolescent girls and young women. As South Africa, we support the theme of global solidarity and shared responsibility. The global impact of the COVID-19 pandemic on our work to ensure that we end AIDS by 2030 has been significant. No government in the world can on its own, without the active support of global and all other social partners, including civil society, defeat the colliding pandemics of HIV, of TB, and of COVID-19. We are much better and we are much stronger when we stand together and in sharing our responsibility towards building an HIV-free society. Global solidarity demands that we double and increase our efforts, increase our capacities and our resources to support and encourage the 38 million plus people currently living with HIV globally. Shared responsibility requires all of us to support and encourage all those people who have not tested to test, and to support all those people who have tested to take treatment, and to support all those people who are taking treatment to remain taking that treatment so that they are virally suppressed. Global solidarity and shared responsibility, it's about working together to achieve what the World Health Organization Director General, Dr. Tedros, argued for, that universal health coverage means all people have access to all the services they need for all the diseases they have and all the conditions that they live under. This is important since HIV and TB becomes exacerbated by inequality in the lack of access to health infrastructure and social safety nets. For us as governments, guaranteeing human rights and public health are mutually inclusive. We are required to put people at the center, especially people most at risk of infection and those who are marginalized amongst ourselves, namely women and girls, adolescents, sex workers, people who inject drugs, and transgender people. As a country, we have made great strides in meeting the first target of ensuring that people know their HIV status. At present, 92% of the people living with HIV know their status. Of course, there are provinces that are doing better than others. But in general, South Africans are now testing, and this behavior needs to be encouraged and it needs to be maintained. We have ensured that 73% of people diagnosed with HIV receive sustained treatment. Therefore, the country has a treatment gap of 17%. Those are the people that have tested, they've started treatment, and along the way, they abandoned the treatment. We are encouraged that our country's performance to reach a 90% viral suppression level now stands at 88%. That means we are at 92% in terms of our people that have tested. We are at 73% of our people that have tested and are taking treatment. And we're at 88% of those people who are taking treatment, we have got their viral load suppressed. As we record these successes, we need to remain focused and initiate more and more people on treatment, as well as make sure that they stay on treatment and are virally suppressed. I am encouraged by the work done in this facility and the community at large. working in partnership with this health facility here at Itireleng. The work that is being done on a daily basis to find those people who have tested but are not taking treatment is much appreciated. It is important that HIV-infected people start treatment and stay on treatment in order to limit transmission and the rate of new infections. Together we can do this. Together as a country, we can reach the remaining 90 targets and ensure that HIV and TB are turned from perceived death sentences into manageable and treatable diseases. We're encouraged by the recently released Tembisa, which is a leading mathematical model of HIV in South Africa. According to this model, most provinces are making progress in the attainment of the 90 targets, with KwaZulu-Natal leading in this fight. We must congratulate and commend the leadership of KwaZulu-Natal province. Together, we need to build on this progress and accelerate our efforts. Most importantly, as government, we remain committed to address concurrently HIV, TB, and COVID-19. Our programs and resources are dedicated to respond in equal measure to these multiple health conditions, along with non-communicable diseases, without sacrificing one for the other. By taking this approach, we will be able to rationalize our scarce resources and improve efficiencies without one problem undermining the other problem. Ladies and gentlemen, we remain committed to reach the National Strategic Plan targets of reducing the number of new infections to less than 100,000 by 2022. However, our task at hand is facing more tangible hurdles due to unfortunate behavior patterns where the use of preventative and protection measures against HIV infections are underutilized. We are very concerned about our behavior. We are very concerned about the use of all preventative and protection measures that we were using to try and limit the scourge of HIV and AIDS. We are not encouraged by this behavior that we are seeing. It is further concerning that men generally do not come forward to test. It is concerning that gender-based violence and femicide is a rising epidemic in South Africa. We must be concerned, all of us, about this violence that is meted against women and girl children. Together we must stand up and fight the scourge of violence against women and children. Partnerships with our communities and accountable leadership among all our social partners are vital to recommit to building social cohesion and moral regeneration in the family, at school, and in all places of work. Our history as a nation is steeped in unity of purpose. Every battle towards building a non-racial, non-sexist, democratic South Africa has been possible because of our conscious decision as a people to stand together and craft a different path for our nation. The same approach of partnership and of a united action is what is required to combat the spread of HIV and TB in our communities. We need the same unity of purpose in ending gender-based violence and femicide. If we embrace collective and shared responsibility, we can ensure that no new infections are registered in our families, in our communities, and in our workplaces. For us to be victorious against HIV and AIDS, we need to be victorious against the social and economic injustices that undermine our day-to-day efforts. We commemorate this World AIDS Day in the middle of 16 days of activism against the abuse of women and children. It is critical for us to decisively address gender-based violence and femicide, inequality, and insecurity. We must also ensure that all marginalized groups, especially young women, have equal access to education, have equal access to health and employment. If we fail to do this as a nation, all our efforts to address HIV and AIDS will be futile. Partnership and leadership are needed to address patriarchy and toxic masculinity that fuel gender-based violence and sexual transmitted infections. Rebuilding social cohesion is critical not only in HIV prevention, but in the elimination of violence against women, children, and some of our key population. The setback that we have encountered towards fully reaching the 1990 can be corrected. We can be back on track to end HIV and AIDS by 2030 by doing the basic rights, which includes dispensing multi-month HIV medicines in primary healthcare facilities. We must ensure that frontline workers like nurses, the midwives, are protected and given the requisite safety equipment to be effective in their work on a daily basis. One critical success factor of the HIV response is the importance of support and buy-in from communities to ensure that there is seamless coordination of the HIV and TB response at all levels. Key amongst these stakeholders and partners are the AIDS councils at a provincial, district, and local level. We must commend some of the provinces that have established provincial AIDS councils. We must commend the districts that have created the AIDS councils. Some of the locals are still battling. Community support and community centers like this one remain the backbone of our fight against HIV and TB. Since the launch of the current National Strategic Plan, we've been working with the provinces and our district to build the necessary capacity for our AIDS councils to effectively lead the coordination and implementation of the strategic plan. Like I've said, I'm very encouraged that all the 9 provinces, we can say without any reasonable doubt that they have their AIDS councils, and these AIDS councils are up and running. I want to take this opportunity to applaud all the premiers who have committed to providing leadership on these AIDS councils, including the premier that is sitting here. Thank you very much, Premier, for that leadership. But we are going to urge our premiers not to delegate this responsibility going forward. They must lead it themselves. We will not succeed in our response without the full commitment and participation of our leaders at all levels. So it's important for our premiers to stay the course. We are in this together. So let us all pull together to intensify our response to these epidemics. Ladies and gentlemen, building on the great successes of the consensus that has accompanied and strengthened our response over the period of more than a decade, government and civil society sectors have agreed to strengthen their partnership on service delivery and implementation of priority programs and campaigns. Strong partnership among the sectors of SANAC remain a cornerstone for our effective response to the challenge of HIV and TB and for our success. In this regard, in the last SANAC extended plenary, the plenary approved the partnership strategy between government and civil society sectors. This partnership is actually the binding thread that elevates SANAC as one of the best practice models globally, wherein government and social partners work together towards achieving a common goal of saving lives. Today, we are officially launching this partnership that will see government departments, civil society sectors working together towards achieving the goals of our National Strategic Plan. That is why it's very important to commend and support this facility, Itireleng, because this is a clear indication that as government, with all our institutions, especially health institutions, we can work, we can partner with civil society in the delivery of services. Allow me to congratulate the management of this clinic and the SANAC sector of people living with HIV for deciding to form a partnership to bring back on treatment those people who have been lost in the program. This is a very important step in ensuring that the sector of people living with HIV supports the work of this clinic, and together they find sustainable solutions to challenges that are faced by people living with HIV in this vicinity. In conclusion, program directors, in this collective journey, we thank our local and our international partners for working with us. We want to urge our partners, including the UNAIDS, the Global Fund, PEPFAR, and others, to continue to support our national response as they have been doing over the past years. This is a partnership that we will always cherish as a country, which symbolizes in action and in deeds genuine global responsibility and partnership that makes a tangible difference. Let me wish you, all of you here, a very good and a successful World AIDS Day.